Welcome back, everyone. Today we're going to be discussing one of the most important responsibilities of an EMT, medication administration. As EMTs, you'll encounter medications frequently, whether it's administering oxygen, helping a patient with their inhaler, or giving life-saving drugs like epinephrine or naloxone.
This sounds like a big responsibility. I know how important it is to get the right medication and dosage, but it also seems like there's a lot to know.
You're absolutely right. Accuracy is paramount when it comes to medications. Any mistake could seriously harm the patient. But don't worry, we're going to break it down step by step and cover everything you need to know to administer medications safely and effectively.
That's reassuring. Where do we even begin?
Let's start with the guidelines that govern medication administration for EMTs. These are influenced by two main factors: your state or local scope of practice. Each state has its own rules about what medications EMTs are allowed to administer. These are set by regulatory bodies like your state's EMS office. You also have medical direction. EMTs always work under the supervision of a physician, either through pre-established protocols offline or direct communication online. This ensures every medication given is approved and monitored.
So even if I know how to give a certain medication, I can't do it unless my state and medical direction allow it.
Exactly. It's a system designed to keep patients safe. Now, before we even think about administering any medication, it's crucial to know where to find reliable drug information. Some trusted resources include the Physician's Desk Reference, PDR, which is a comprehensive guide to prescription medications, covering everything from uses to side effects and contraindications. Another great tool is Epocrates, a mobile app that provides up-to-date information on drugs, interactions, and clinical guidelines right at your fingertips. For quick access in the field, the EMS Pocket Drug Reference Guide is specifically designed for EMTs and offers easy on-the-go information about key medications we use.
Those sound really helpful. So once we've consulted our resources and confirmed it's okay to administer a medication, what's next?
Understanding the drug itself is essential. We need to know a few key things. First, what is a drug? A drug is any chemical substance that interacts with the body to produce a physiological effect. Now let's think about some examples of drugs commonly used by EMTs. Oxygen, oral glucose, activated charcoal, aspirin, inhaled bronchodilators like albuterol and Zopinex, nitroglycerin, epinephrine, and naloxone Narcan. And how do these drugs help treat or prevent conditions? By targeting specific body systems, they can either alleviate symptoms or address the underlying cause of a condition. For example, aspirin can help prevent blood clots from worsening during a heart attack, while albuterol works by relaxing the airway muscles, making it easier for the patient to breathe.
It's interesting how different medications can work in such different ways.
Each medication has a unique mechanism of action, but they all aim to produce a specific therapeutic effect. But it's important to remember that every drug has the potential for side effects. Using the wrong medication, incorrect dosage, or wrong route of administration can have dangerous consequences.
That makes sense. Can you give us some examples of what could happen if a medication is given incorrectly?
Absolutely. Let's say we give nitroglycerin to a patient with low blood pressure. Because nitroglycerin dilates blood vessels, it could cause a dangerous drop in their already low pressure. Or, if epinephrine is given incorrectly, it could cause a dangerously fast heart rate and increased blood pressure, especially in someone with a heart condition.
So we need to be extremely careful and double-check everything before administering anything.
Precisely. Now let's talk about how we identify medications. Each drug has 4 types of names. First, the chemical name. This describes the drug's exact chemical structure. It's usually complex and not something we commonly use as EMTs. For example, acetylsalicylic acid is the chemical name for aspirin. Next, we have the generic name, which is a simpler version of the chemical name. EMTs often use generic names like acetaminophen. Then there's the trade name, which is the brand name created by the manufacturer. These are the names patients are most familiar with, like Tylenol for acetaminophen or EpiPen for the epinephrine autoinjector. Finally, we have the official name. This is usually the same as the generic name, but it's followed by USP or NF to show that it meets official standards like ibuprofen USP.
It's helpful to understand these different names, especially since patients might refer to medications by their trade names.
Right. Now, let's move on to the different ways medications can be administered, which we call routes of administration. Oral is one of the most common routes, where the medication is swallowed and absorbed through the digestive system. Sublingual involves placing the medication under the tongue, where it's absorbed rapidly into the bloodstream. Inhalation means the medication is breathed into the lungs, typically through an inhaler or nebulizer. Intranasal IN is where the medication is sprayed directly into the nose, allowing for quick absorption. Subcutaneous involves injecting the medication under the skin, where it's absorbed more slowly. And finally, intramuscular is when the medication is injected directly into a muscle, allowing for faster absorption compared to subcutaneous injections.
Why are there so many different routes?
Each route has its advantages and disadvantages, and the best one depends on the specific medication and how quickly we need it to work. We'll dive deeper into each route later, but for now, let's talk about the different forms medications can come in. Compressed powder or tablet is one of the most common forms. These are either swallowed or dissolved under the tongue. Aspirin and nitroglycerin tablets are good examples. Liquid for injection is typically delivered via injection, often intramuscularly IM or intranasally IN. Epinephrine and naloxone are common examples of medications in this form. Gel is designed to be absorbed through the mouth's mucous membranes, like oral glucose gel. Fine powder for inhalation is used with inhalers. A good example is albuterol, which helps open up the airways. Gas is inhaled directly. The most common example we see in the field is oxygen. Spray is an aerosolized form that can be delivered either sublingually or intranasally. Nitroglycerin spray and Narcan nasal spray are examples. Finally, the auto-injector is a pre-filled device for intramuscular injection, like the EpiPen for epinephrine.
That's a lot of different forms. It's amazing how medication technology has advanced.
Absolutely. This variety of forms allows us to administer medications effectively in different situations. But before we give any medication, there's some crucial information we need to know. Indications refer to the conditions or symptoms for which the medication is appropriate. Contraindications are the conditions or circumstances that make it unsafe to use the medication. Dose is the correct amount to administer based on the patient's needs and protocols. Administration refers to the method of delivery, like oral or inhalation. Actions describe how the medication works in the body to produce its intended effect. And finally, side effects are the unintended reactions that might occur when the medication is given.
So we need to consider all these factors every time?
Absolutely. It's a multi-step process, and we're going to go over each step in detail now. Okay, let's move on to some specific medications you'll likely encounter as EMTs. We'll go through each one, discussing its indications, contraindications, the correct dosage, route of administration, actions, and potential side effects. Remember, this is just an overview. Always consult your local protocols and medical direction for specific guidelines.
Sounds good. I'm ready to learn about these life-saving drugs.
Great. Let's start with oxygen, which is often the first treatment we administer in many emergencies.
Oxygen seems pretty straightforward. You just give it to people who are having trouble breathing, right?
It's true that oxygen is frequently used for patients with respiratory distress, those showing signs of hypoxia or trauma victims. We also administer it when a patient's SpO2 drops below 94%. However, there are precautions to consider, even with something as seemingly simple as oxygen.
Really? What kind of precautions?
While oxygen can be life-saving, giving high concentrations for prolonged periods, especially when not needed, can have negative effects. Studies show that too much oxygen can reduce blood flow in the coronary arteries, potentially causing problems for those with heart disease.
So we have to be careful not to give too much?
Exactly. We need to assess the patient and their SpO2 levels carefully. We also need to differentiate between medical and trauma patients. Medical patients generally need a lower flow rate, while trauma patients often require a higher concentration of oxygen. If a patient needs ventilation support with a bag valve mask, we always provide a high concentration of oxygen, regardless of the cause.
That makes sense. What about oral glucose? When do we use that?
Oral glucose is a critical treatment for hypoglycemia, particularly in diabetic patients. When blood sugar drops too low, brain cells can become starved for energy, leading to confusion, weakness, or altered mental status.
So we give them sugar to bring their blood sugar back up?
Precisely. Oral glucose provides a quick source of energy that helps restore normal brain function. But again, there are important considerations. We only administer oral glucose if the patient is alert enough to protect their airway and swallow safely.
Why is that so important?
If they can't protect their airway, the glucose could enter their lungs, leading to aspiration and further complications.
Okay, I understand. Are there other precautions to consider?
Yes, there are two main ways to administer oral glucose: buccal and oral. Buccal means placing the gel between the cheek and gums for absorption, while oral means swallowing it. We choose the route based on the patient's ability to swallow and protect their airway.
What are the signs we should look for to indicate oral glucose is needed?
Well, the most obvious sign is a low blood sugar reading, typically below 60 to 70 milligrams per deciliter. But sometimes we might not be able to get a blood glucose reading immediately. If a diabetic patient exhibits signs of hypoglycemia, we should administer oral glucose even without a confirmed reading.
It's better to be safe than sorry in that case.
Exactly. The risk of untreated hypoglycemia, which can lead to seizures or even coma, is far greater than the risk of giving glucose to a patient whose blood sugar might not be that low.
What about activated charcoal? I've heard that's used for poisoning cases.
That's right. Activated charcoal was once a standard treatment for many poisonings, but its use has become more selective. It works by binding to the poison in the digestive system, preventing it from entering the bloodstream.
So it's like a sponge that soaks up the poison.
That's a good way to think about it. However, it's crucial to understand when activated charcoal is not appropriate. For instance, we never give it for caustic substance ingestion, such as bleach or strong acids. Activated charcoal doesn't neutralize those substances and could even make it harder to assess the damage to the digestive tract. Also, we only administer activated charcoal if the patient is alert and able to protect their airway. Otherwise, there's a significant risk of aspiration, which could cause severe lung complications.
That makes sense. It sounds like we need to be extra cautious with activated charcoal.
You're absolutely right. Always follow your protocols carefully and contact medical direction if there's any doubt. Now let's move on to a medication you've probably heard of: aspirin. All right, let's talk about aspirin. As you probably know, aspirin is commonly used for pain relief, but in the EMS setting, we use it for a very specific purpose.
Is that for heart attack patients?
You got it. Aspirin is a crucial medication for patients experiencing chest pain or discomfort that suggests a heart attack, medically known as a myocardial infarction or MI. We also use the term acute myocardial infarction or AMI to describe a heart attack that's happening right now.
So it's not really about relieving their pain.
Well, it can help with that, but the primary reason we give aspirin in this situation is to prevent the blood clot from getting worse. You see, during a heart attack, a clot forms in one of the coronary arteries, which are the blood vessels that supply oxygen to the heart muscle. Aspirin helps keep that artery from becoming completely blocked.
How does it do that?
Aspirin interferes with platelet function. Platelets are tiny cells in the blood that help form clots. By preventing them from sticking together, aspirin reduces the chance of that artery getting totally blocked. This can help limit the damage to the heart muscle.
That's amazing. So we just give them a regular aspirin tablet?
Not exactly. It's important that the patient chews the aspirin rather than swallowing it whole. Chewing it allows for faster absorption, so it starts working quicker. The sooner we can get that aspirin working, the better the chances of preventing further damage to the heart.
Are there any times when we shouldn't give aspirin?
Absolutely. There are some important contraindications to be aware of. For instance, we never give aspirin to someone who is allergic to it or has active bleeding. We also need to be careful with patients who have a history of stomach ulcers or are taking blood thinners. In those cases, we'd need to consult with medical direction before giving aspirin.
So always check for allergies and bleeding risks.
You got it. And like with any medication, we need to make sure the patient can swallow and protect their airway before we give them anything by mouth.
Got it. So, quick action with aspirin is key during a heart attack.
Precisely. Early aspirin administration is one of the most important things we can do for a patient with a suspected MI. The sooner we give it, the better their chances of survival and recovery. All right, let's move on to another important class of medications: inhaled bronchodilators. These are medications that help open up the airways in the lungs, making it easier for patients to breathe.
I know people with asthma use inhalers. Are these the same thing?
Exactly. Inhaled bronchodilators are commonly used to treat conditions like asthma, emphysema, and chronic bronchitis. These conditions involve bronchoconstriction, which is when the muscles around the airways tighten up, making breathing difficult.
So these medications relax those muscles?
That's right. Inhaled bronchodilators are typically beta-2 agonists, which means they work by stimulating specific receptors in the lungs that cause the airway muscles to relax. This allows the airways to widen and lets more air in.
What are some examples of these medications?
Two common ones are albuterol and levalbuterol. Albuterol is often the go-to choice, and levalbuterol is similar, but sometimes preferred because it may cause fewer side effects like a rapid heart rate.
And these are given through inhalers?
Yes, we can assist patients with their metered dose inhaler, MDI, which delivers a pre-measured dose with each puff. We might also use a small volume nebulizer, SVN, which turns the medication into a mist that the patient inhales over time.
Are there any times when we shouldn't use these medications?
Like all medications, there are contraindications. We wouldn't use them if the patient has a known allergy to the medication, if they're unable to protect their airway, or in some cases if they don't have a prescription for it. It's important to know that the rules on whether EMTs can give these medications without a prescription vary depending on the state and local protocols.
So, always double-check our protocols.
Absolutely. And remember, we need to make sure the patient is using the inhaler correctly and is able to take a good deep breath to get the medication down into their lungs.
What about Atrovent? I've heard that used with respiratory problems too.
Good question. Atrovent, also known as ipratropium bromide, is another type of bronchodilator, but it works differently from the beta-2 agonists. It's an anticholinergic medication, meaning it blocks a chemical that causes the airways to constrict. This helps keep the airways open and is often used in combination with albuterol for a more comprehensive effect.
So they work together to make breathing easier?
Exactly. The combination of albuterol and Atrovent can be very effective for patients with COPD or other chronic respiratory conditions. Now let's discuss nitroglycerin, a medication commonly used for patients with heart conditions, especially those experiencing angina or a myocardial infarction.
I've heard of angina. Isn't that chest pain caused by problems with blood flow to the heart?
You're exactly right. Angina is chest pain that occurs when the heart muscle isn't getting enough oxygen-rich blood. This is often due to narrowing or spasms in the coronary arteries, the blood vessels that supply the heart.
And nitroglycerin helps with that?
Yes, nitroglycerin is a vasodilator, meaning it relaxes and widens blood vessels. This helps to reduce the workload on the heart and improve blood flow to the heart muscle, relieving the chest pain.
So how do we give nitroglycerin?
Nitroglycerin is typically administered sublingually, meaning it's placed under the tongue. It's absorbed quickly into the bloodstream through the blood vessels there. It's usually given as a small tablet or spray.
Can we give nitroglycerin to anyone with chest pain?
Not at all. It's crucial to remember that nitroglycerin is a patient-assisted medication. We can only help a patient administer their own prescribed nitroglycerin. It's also important to check the patient's blood pressure before giving nitroglycerin. If their blood pressure is too low, giving them nitroglycerin could make it dangerously lower.
Are there other times when we shouldn't give nitroglycerin?
Definitely. We should never give nitroglycerin to patients who have recently taken medications for erectile dysfunction, like Viagra or Cialis. These medications can interact with nitroglycerin and cause a severe drop in blood pressure. We also wouldn't give it to someone with a head injury.
So there are some definite red flags to watch out for.
You got it. And remember, it's essential to monitor the patient's blood pressure closely after giving them nitroglycerin. We want to make sure it's helping and not causing any adverse effects.
Okay, I'll keep all of that in mind.
Okay, let's shift gears and talk about epinephrine, a medication that's absolutely critical in life-threatening allergic reactions, also known as anaphylaxis.
I know that people with severe allergies often carry EpiPens. Is that what we're talking about?
Exactly. EpiPens are epinephrine auto-injectors, which deliver a pre-measured dose of epinephrine. Anaphylaxis is a very serious condition. The body's immune system goes into overdrive and it can cause the airways to swell shut, making it impossible to breathe. It can also cause a dangerous drop in blood pressure.
So epinephrine helps reverse those effects.
That's right. Epinephrine works by stimulating the sympathetic nervous system, which helps to counteract those life-threatening effects of anaphylaxis. It causes the blood vessels to constrict, which increases blood pressure. It also relaxes the muscles in the airways, making it easier to breathe.
So if someone's having an allergic reaction and they have an EpiPen, we can help them use it?
Absolutely. In fact, we encourage them to use it themselves if they are able. But some states allow EMTs to administer epinephrine from a vial using a pre-measured kit, so you'll need to know your local protocols.
Are there any times when we shouldn't give epinephrine?
That's a great question. While there are general contraindications for many medications, epinephrine has almost none in a true anaphylaxis emergency. Think about it. If someone's airways are closing up and their blood pressure is plummeting, we need to act fast. The potential benefits of epinephrine far outweigh any risks in that situation.
Wow, that's good to know. So even if someone has a heart condition, we'd still give them epinephrine for anaphylaxis.
You got it. The priority is to open the airway and stabilize their blood pressure. Delaying epinephrine in a life-threatening allergic reaction could be fatal.
So basically, epinephrine is a must-have for anaphylaxis.
You've got it. It's one of the most important tools we have for managing these emergencies. All right, let's move on to another critical medication, naloxone, better known by its brand name Narcan. This one is a real lifesaver when it comes to opioid overdoses.
I've heard a lot about Narcan in the news lately. What exactly does it do?
Naloxone is an opioid antagonist, which means it blocks the effects of opioids in the body. Opioids like heroin, fentanyl, and prescription painkillers can cause a person's breathing to slow down dangerously, even to the point of stopping completely. They can also cause a drop in blood pressure and loss of consciousness.
So Narcan helps reverse those effects.
Exactly. Naloxone binds to the same receptors in the brain that opioids bind to, kicking the opioids off those receptors and preventing them from having their effects. This allows the person's breathing to return to normal, and they usually regain consciousness. It's a pretty amazing medication because it works very quickly and has no harmful effects if the person hasn't actually taken opioids.
How do we give Narcan?
The most common ways are intranasally, using a special nasal spray, or through an intramuscular injection using an auto-injector. Both methods allow for quick and easy administration, which is crucial in an overdose situation.
So, if we find someone who is unresponsive and we think they might have overdosed on opioids, we should give them Narcan.
Yes, if you suspect an opioid overdose, especially if the person is not breathing or their breathing is very shallow, Narcan should be administered immediately. It could be the difference between life and death.
Are there any times we shouldn't give Narcan?
There are very few contraindications for Narcan. The main one would be if the person is known to be allergic to it, but that's very rare. Even if you're not entirely sure if the person has overdosed on opioids, it's usually safe to give Narcan because it won't cause harm if opioids aren't present.
What happens after we give Narcan?
That's a critical point. It's important to monitor the patient very closely after administering Narcan because the effects of naloxone can wear off before the opioids are completely out of their system. This is especially true with some of the stronger opioids like fentanyl. If the patient's breathing starts to slow down again or they become unresponsive, you may need to give another dose of Narcan.
So we need to be prepared to give more than one dose?
Exactly. And be aware that the person might experience withdrawal symptoms after receiving Narcan, like agitation or nausea. These symptoms can be uncomfortable, but they're usually not life-threatening.
Okay, so Narcan is a powerful tool for helping people who have overdosed.
Absolutely. Knowing how and when to use Narcan can save lives. Given the ongoing opioid epidemic, it's a medication that every EMT needs to be comfortable administering. Now that we've discussed some specific medications, let's talk about dosages. It's crucial to understand that adult and pediatric patients often require different dosages for the same medications.
That makes sense. Children's bodies are smaller and still developing.
Exactly. And their metabolisms can work differently too. Always consult your local protocols and medical direction for specific dosage guidelines, as they can vary. But let's go over some general principles. For oxygen, the dosage depends on the patient's condition and SpO2 levels. When administering oral glucose for hypoglycemia, the typical adult dose is 15 to 25 grams, usually given as one tube. For children, it's 7.5-15 grams, or half to one tube. Activated charcoal is dosed by weight for both adults and children at 1 gram of charcoal per kilogram of body weight. The maximum dose for children is usually 25 to 50 grams. Aspirin isn't typically recommended for children. For adults experiencing chest pain suggestive of a heart attack, the dose is 160-325 milligrams given as a chewable tablet. For albuterol delivered through an SVN, the standard dose is 2.5 milligrams and 3 milliliters of saline for both adults and children. Levalbuterol, another bronchodilator, is dosed at 0.63 to 1.25 milligrams for adults and 0.31 to 0.63 milligrams for children via SVN. Atrovent, an anticholinergic bronchodilator, is given at 0.5 milligrams for adults and 0.2 milligrams for children via SVN. Nitroglycerin is generally not used in pediatric patients. The adult dose is 0.4 milligrams administered sublingually as a tablet or spray. Epinephrine for anaphylaxis is typically given through an autoinjector. The adult dose is 0.3 milligrams. For children, it's 0.01 milligrams per kilogram of body weight, up to a maximum of 0.3 milligram. Naloxone for opioid overdoses can be given intranasally or intramuscularly. Adult doses range from 2 to 4 milligrams intranasally and 0.42 milligrams intramuscularly. For children, it's 0.1 milligrams per kilogram of body weight, up to a maximum of 2 milligrams.
Wow, that's a lot to remember.
You're right, it is. But with practice, these dosages will become second nature. The key is to always prioritize safety and accuracy when administering any medication. Double-check your protocols and make sure you understand the correct dosage for your patient. Okay, let's talk about the different forms medications come in and how that relates to how we administer them.
I've seen pills, liquids, and inhalers. What else is there?
You've named a few. The form of the medication dictates how it's administered and how quickly it works. Let's start with compressed powders or tablets, like aspirin and nitroglycerin. These are solid forms, usually swallowed or dissolved under the tongue. For a suspected heart attack, we want the aspirin to work quickly, so we have the patient chew it for faster absorption. Liquids for injection are delivered by injection. Epinephrine for anaphylaxis and naloxone for opioid overdoses are examples. They can be given intramuscularly or, in some cases, like naloxone, intranasally. Gels are semi-solid, like oral glucose for hypoglycemia. They're usually administered orally, allowing absorption through the mucous membranes in the mouth. Suspensions are liquids with small particles of medication that need to be shaken up before use. Activated charcoal, used for some poisonings, is a good example. Fine powders for inhalation are delivered using an inhaler, which allows the medication to go straight to the lungs for rapid absorption. Albuterol for asthma is often given this way.
Right, I've seen people use inhalers for asthma attacks.
Exactly. Another option for delivering inhaled medications is a small volume nebulizer, or SVN. It turns liquid medication into a fine mist that's inhaled over time. This can be helpful for patients who have difficulty using an inhaler. Then we have gases like oxygen, which are inhaled directly for immediate absorption. Sprays are liquids that are aerosolized, like nitroglycerin spray for chest pain, which is given sublingually, and Narcan nasal spray, which is given intranasally. Autoinjectors are pre-filled devices that deliver a specific dose of medication through an injection, usually intramuscularly. EpiPens for anaphylaxis and naloxone autoinjectors are common examples. We also have lozenges, which dissolve slowly in the mouth, but those aren't common in EMS. And finally, there are suppositories, which are administered rectally. but EMTs rarely use those.
So many forms of medications. How do we keep them all straight?
It does seem overwhelming at first. The key is to become familiar with the medications you're most likely to use in the field and understand the specific form and route of administration for each one. Always double-check the medication label and your protocols to ensure accuracy. Remember, patient safety is paramount. Now that we've reviewed the common medications EMTs encounter, their forms, dosages, and routes of administration, let's focus on the essential steps to ensure safe medication practices in the field. Remember, administering medication is a serious responsibility, and following a structured approach helps prevent errors and safeguard patient well-being.
Absolutely. So what are the key steps we should always keep in mind?
Great question. There are several crucial steps involved. Before administering any medication, whether it's oxygen or a patient-assisted medication, always confirm you have the proper authorization. This might be online, meaning you communicate directly with medical control, or offline by following standing orders or protocols.
So if I'm unsure, it's always best to check with medical control.
Precisely. It's better to be safe than sorry. And when receiving an online order, remember to repeat the medication, dose, and route back to the physician to confirm accuracy. This minimizes the risk of miscommunication and errors. It's your responsibility to select the right medication for the patient's condition, matching it with the order or protocol you've received. Carefully read the medication label and cross-reference it with the order.
Even if the order seems clear, we should still double-check the medication label?
Absolutely. Many drugs have similar names or packaging, so verifying the medication yourself is crucial. Never solely rely on what you've been told. Always confirm it personally. For medications carried by the patient, like an EpiPen or nitroglycerin, it's essential to ensure it's prescribed for them. Verify the patient's name on the label or packaging. Remember, some medications come in containers that don't have the prescription directly on them. If you have any doubts about the medication belonging to the patient, or if the packaging is missing, consult medical control for guidance.
What if the medication looks damaged or tampered with?
That's an important point. If the medication appears compromised, do not administer it. Instead, contact medical control for further instructions. Always check the expiration date before administering any medication. An expired medication may be ineffective or even harmful. Never use an expired medication without first consulting with medical control. They'll advise on the best course of action, which often involves discarding the expired medication.
Makes sense. We wouldn't want to give a patient an ineffective medication in an emergency.
You want to always thoroughly examine the medication before administration. Look for any signs of contamination or damage, such as discoloration, cloudiness, or particles. If you notice any abnormalities, do not administer the medication and contact medical control for guidance. Patient safety is paramount. Take time to double-check that you have the right form of the medication, the proper route of administration, and the correct dose. These factors are crucial and must align with the order you've received. Remember, using the wrong form, administering through an incorrect route, or giving the wrong dose can have serious consequences for the patient.
It's like a triple check system.
Exactly. It's important to think of medication administration as a system of multiple safety checks, all designed to ensure we're providing the best care possible. Now let's talk about the 5 rights of medication administration, which are essential to safe practice. These rights form the foundation of preventing medication errors. Here they are. Right patient. Always confirm you have the correct patient, especially when you're working with more than one patient at a time. Mistakes here can be serious, so double check. Right medication. Make sure you have the correct medication. Whether you're following a direct order or a protocol, it's crucial to confirm that the medication matches what's intended for this specific patient. Right dose. Verify that the dosage is accurate based on the order or protocol. A small difference in dose can have a big impact. Right route. Confirm that you're administering the medication through the correct route, whether it's oral, intranasal, or another method. Giving a drug the wrong way can reduce its effectiveness or even harm the patient. Right time. Timing is key. Make sure you're administering the medication at the correct time. factoring in the patient's condition and the urgency of the situation. And finally, document everything. After you've administered the medication, your job isn't done until you've documented all the critical details. Drug, record the exact name of the medication given. Dose, write down the specific dose administered. Be clear about how the medication was given. Was it oral, intranasal, or something else? Time, note the exact time the medication was administered. Patient's condition, most importantly, document any changes in the patient's condition. Did they improve, worsen, or show any side effects? Following these steps helps ensure accuracy and safety in medication administration. Remember, each of these rights plays a vital role in patient care.
So it's not just about giving the medication, it's about the whole process, from confirming the order to observing the patient afterward.
You've got it. Safe medication administration involves a series of checks and balances to ensure we're delivering care effectively and protecting our patients. Don't forget that reassessment is crucial after medication administration. We'll cover that in more detail shortly, along with the importance of being prepared to adjust treatment based on the patient's response. Remember, it's a dynamic process, and our actions directly impact patient outcomes. All right, let's pick up where we left off. We've discussed the importance of obtaining authorization, verifying prescriptions, checking expiration dates, and following the 5 rights. Now, what happens after we administer medication?
We watch the patient to see how they respond, right?
Exactly. Reassessment is a crucial part of medication administration. It allows us to determine if the treatment is working and helps us catch any potential issues early. So, what should we focus on during reassessment? One of the key things to monitor is the patient's level of consciousness and alertness. Are they becoming more alert, or are they getting drowsy? Any changes in their mental status could be a sign that something isn't right, and we need to act quickly if we notice those changes.
So if a patient with hypoglycemia received oral glucose, we'd expect them to become more alert?
Exactly. If their mental status worsens, it could mean the glucose wasn't effective, or there could be another underlying issue we need to address. Now let's talk about the airway. The airway is always a priority. After administering any medication, especially those that might affect a patient's ability to protect their airway, we need to ensure it stays clear and open. Monitoring the airway is critical to avoid complications.
Like if they become drowsy after receiving pain medication.
Yes, or if they're experiencing throat swelling after an allergic reaction, which can affect their airway. Let's move on to breathing. We need to monitor the patient's respiratory rate, depth, and effort. Are they breathing faster or slower than normal? Are their breaths deep or shallow? Do they appear to be struggling to breathe? These are important signs to watch for. Next is circulation. During reassessment, checking the pulse and blood pressure is crucial. Is the pulse strong or weak? Is it regular or irregular? And is the blood pressure within a normal range? These vital signs give us key insights into how well the circulatory system is functioning. Finally, don't forget to assess the skin. Is it warm and dry or cool and clammy? The condition of the skin can provide valuable information about the patient's circulation and overall perfusion.
Right. Pale, cool skin could be a sign of shock.
Exactly. We need to stay alert for any changes in the patient's skin condition, as it can provide valuable clues about their overall status. Now let's talk about other important checks. Depending on the patient's condition, we may need to recheck their SpO2 levels and blood glucose to ensure they're within a safe range. And of course, it's essential to ask the patient how they're feeling. Has the medication helped? Are they noticing any side effects? Getting feedback directly from the patient is a key part of reassessment. Reassessment is an ongoing process. It doesn't stop after the initial check. We need to keep monitoring the patient throughout transport and be ready to adjust our treatment plan based on their response.
So if the medication isn't working or the patient's condition worsens, what do we do?
We may need to administer additional doses of medication as long as it's within our protocols. Or we may need to request ALS backup if the patient requires more advanced interventions. The key is to stay vigilant and be proactive. Reassessment helps ensure that our patients receive the most effective care possible. Any questions about reassessment? All right, we've covered a lot of ground today about safe medication practices. Now let's talk about what to do when a patient experiences side effects from a medication we've administered or assisted with.
That's important. What are some common side effects we might encounter?
Great question. Side effects can vary depending on the medication, but there are some common ones we often see in the field, including nausea and vomiting, dizziness and lightheadedness, headache, increased heart rate, tachycardia, anxiety and agitation, allergic reactions ranging from a mild rash to severe anaphylaxis. Let's look at a few specific examples based on the medications we've discussed. Epinephrine can lead to an increased heart rate, anxiety, or tremors. Nitroglycerin often causes headaches or dizziness because of its effects on blood vessels. Naloxone Narcan can result in withdrawal symptoms such as agitation, nausea, and tachycardia. Understanding these potential side effects helps us monitor the patient and respond quickly if they occur.
So, what should we do if a patient starts experiencing side effects?
First, stay calm and reassuring. Let the patient know that you're aware of the situation and you're there to help. Side effects are often temporary and manageable. Here are some general steps to take. Stop the medication if it's safe to do so. Always consult medical control if you're unsure. Monitor the patient's vital signs closely. Provide supportive care, such as oxygen if needed. Document the side effects thoroughly in your patient care report. Contact medical control for guidance, especially if the side effects are severe or you're unsure how to manage them. It's crucial to remember that even though we strive to prevent them, side effects can occur. Being prepared and knowing how to respond is essential for patient safety. Any questions about managing medication side effects? As EMTs, we must take every precaution to avoid medication errors. Administering the wrong medication, the wrong dose, or via the wrong route can have serious consequences for the patient. So let's talk about some strategies to minimize these risks.
That sounds really important. What are some of the most common causes of medication errors?
That's a good question. There are several factors that can lead to medication errors, and it's important to be aware of them. One major factor is distractions and interruptions. The emergency setting can be chaotic, with noise, other personnel, and the patient's condition all competing for your attention. It's easy to get distracted, which increases the risk of errors. Whenever possible, try to find a safe, quiet space to prepare and administer medications, minimizing the chances of mistakes.
That makes sense. It would be easy to make a mistake if you're trying to draw up a medication while someone's yelling in your ear.
Exactly. Minimizing distractions is key to reducing errors. Another common issue is incomplete or misinterpreted information. Sometimes the information we receive about a patient's medication history is unclear or incomplete. Before administering any medication, it's critical to clarify any uncertainties. Double-check the details, ask questions, and ensure you have all the necessary information to avoid potential mistakes.
So if we're not sure what medication a patient is taking or what dose they normally take, we should check with medical control or the patient's family.
Yes, exactly. If the patient has a prescription bottle, check it for details. It's always better to err on the side of caution and gather as much information as you can before administering any medication. Another factor is poor communication. Miscommunication between EMTs or between EMTs and medical control can lead to serious errors. It's vital that everyone involved in the patient's care is on the same page. Clear, concise communication is key to ensuring safe and effective treatment.
So, repeating back orders to medical control and clearly communicating with our partners are crucial?
Absolutely. Clear communication is essential for preventing medication errors. Another critical factor is lack of knowledge or skill. If you're not familiar with a medication's indications, contraindications, dosage, or route of administration, the risk of making a mistake increases significantly. That's why it's so important to stay current with our pharmacology knowledge and continuously sharpen our skills. Regular review and training help us avoid errors and provide the best possible care.
That's why it's so important to study our protocols and attend continuing education courses.
You got it. Continuing education and regularly reviewing protocols ensure we're providing safe and effective care. Another issue to be mindful of is medication name confusion. Many drugs have similar sounding names or even similar packaging. Always double check the medication name and its strength before administering to avoid any mix-ups.
So it's important to pay close attention to those details, even if we think we know the medication?
Exactly. Never assume you have the right medication just because the name sounds familiar. Always verify it. Another factor to consider is improper medication storage. Medications that aren't stored correctly can lose their effectiveness or even become contaminated. It's essential to follow storage guidelines to ensure medications remain safe and effective for use.
So, we should make sure our drug boxes are kept at the right temperature and that medications are protected from light and moisture.
Yes, and we should also check for expired medications regularly. By being aware of these common causes of medication errors and taking steps to avoid them, we can significantly improve patient safety. It's important to remember that even small errors can have significant consequences. Always prioritize accuracy, clarity, and carefulness when handling medications.
These are great tips. It's clear that avoiding medication errors is a top priority in EMS.
Absolutely. It's a responsibility we all share, and our commitment to safe practices directly impacts the well-being of our patients. All right, everyone. We've covered a lot today about medication administration, so let's wrap up by highlighting some key takeaways. As EMTs, we play a vital role in ensuring patients receive medication safely and effectively. It's important to remember that our scope of practice determines which medications we can administer or assist with, and we always operate under medical direction. We've discussed the importance of following protocols, verifying prescriptions, checking expiration dates, and adhering to the 5 rights: the right patient, medication, dose, route, and time. These principles are non-negotiable and form the core of safe medication administration. Being familiar with the medications we carry and those commonly prescribed to patients is essential. Understanding their indications, contraindications, dosages, routes of administration, actions, and potential side effects is key to providing high-quality care. After administering a medication, our job doesn't end. We must continuously monitor the patient's response, watching for both improvements and any potential side effects. As EMTs, we are our patients' advocates, ensuring their safety and well-being throughout our care. We also talked about strategies to minimize medication errors, avoiding distractions, clarifying information, communicating clearly, and staying up to date with our pharmacology knowledge. Vigilance and attention to detail are critical in preventing mistakes that could put our patients at risk. Administering medications is a significant responsibility and a privilege. By mastering these principles and techniques, we contribute to positive patient outcomes. Never underestimate the impact we have as EMTs. Our knowledge and skills can truly make a difference in life-threatening situations. Thank you all for your time today. If you have any questions or need help, don't hesitate to reach out to us. We're here to support you.